how you would identify kind of a pseudo ST elevation versus an actual ST elevation. So like, when does it count as like myocardial ischemia? And the classical way that you're going to end up seeing this shown is that when you have your QRS complex and you have your ST or your T wave afterwards, if you have kind of a concave appearance here where the T wave comes up and it's kind of scooped out in appearance there, that usually represents a non-real ST segment elevation, meaning it doesn't usually represent the fact that we actually have some kind of ischemia to the heart. If, however, you have a QRS complex where afterwards you have kind of a convex shape to the T wave, where it almost literally looks like a tombstone, that is when you have real ST segment elevations. I will point out that this is a fairly obscure thing for exams. It's unlikely for them to give you an ST segment elevation that would be classified as a pseudo ST elevation on the real test. You might see this clinically, you might be asked about this clinically, but on the exam, if you see an ST segment elevation, I would tend to treat it as a real finding. That being said, I do want to emphasize that ST segment elevations do happen for 3 separate reasons on the USMLE or level exams. The first one is the one we've discussed, which is current myocardial ischemia and myocardial infarction. However, myocardial infarctions are usually limited to specific leads on the EKG. And if you find that every lead on the EKG has ST segment elevations, that usually is not a heart attack, because it would be strange to see a heart attack in literally every artery on the heart at the same time. So instead, we would say, an excellent answer from somebody in the chat, pericarditis is usually what we see for pan-ST elevations or diffuse ST elevations on the EKG. So myocardial infarction, localized ST segment elevations, pericarditis, global ST segment elevations. On the other hand, the final thing that can cause ST segment elevations is if you have a ventricular aneurysm, if scar tissue forms in the area where the heart attack occurred, and now that area is paradoxically moving the wrong direction with every heartbeat because it's no longer muscular tissue, it's now scar tissue, you're going to find that the ST segment elevations from the original heart attack persist forever in these patients. And so what you might find when a patient comes into clinic, you might see ST segment elevations in the same place they just had a heart attack 3 months ago, and they're sitting there talking with you totally normal vital signs and everything. And without freaking out and sending them to the ER immediately for a cardiac catheterization, you might recall, oh, right, if they have ventricular aneurysm, which might not be particularly symptomatic, they could have ST segment elevations that persist. So ventricular aneurysm, pericarditis, and myocardial ischemia are the big 3 for ST segment elevations. I would anticipate that they would be real if you were to see them on the exam and not pseudo ST elevations. I will count Prinzmetal's angina as being a form of myocardial ischemia, so that technically falls into my purview, but yes, you can end up seeing ST segment elevations in Prinzmetals as well. Very astute observation there by one of our students in the audience there.